Hello, everyone. My name is Keisha Love, and this is my oral presentation on clinical visit. Okay. The agenda for this presentation starts with the question review, a health professional introduction, an interview summary, and an interview reflection. First off, for the question review, these are just 5 additional questions that I decided to add in addition to the questions we all received, and I believe they covered a good range of topics pertaining to Hispanic patients and medical treatment and care, as well as those cultural beliefs and maintaining trust. I really liked the way that my interviewee answered them, and I'm excited for you all to see that in this upcoming presentation. So, just for some introduction to who my health professional was and to get to know a little bit more about them, I decided to interview an EMT that stands for Emergency Medical Technician, excuse me, and they're kind of the same thing as a paramedic, only difference is that they cannot administer drugs. And how I like to describe an EMT or paramedic is that they're basically that centerpiece in transportation, from getting you from the house or wherever you are to the hospital or to a doctor or nurse. For example, you call the ambulance, they come transport you, they pick you up, they do whatever they have to do to keep you alive and well until you are able to be seen by a doctor or another healthcare professional or provider. Specifically, my healthcare professional works for CareFlight. That is an active medical company, transportation company, and service here in the DFW Metroplex. They oftentimes you can see their helicopter flying from like Fort Worth all the way to East Texas, and they especially operate in rural areas to pick up those who aren't as close to hospitals, so like way off in like East Texas or like West Texas and Ranger, Texas. And so they'll transport those and bring them to the city because, especially with DFW traffic, oftentimes it's just quicker and safer. Especially if, like, a patient needs open heart surgery, that's going to be the fastest option. And they work with a lot of hospitals in the DFW Metroplex, like UT Southwestern and Baylor. So I went ahead and broke down this interview into a couple subcategories, and the first is going to be family and language. Basically, my interviewee let me know that Spanish knowledge is helpful, but specifically within CareFlight, many of the EMS teams will have a translator or at least one partner who knows how to speak Spanish. And then having that one greatly improves communication and helps Hispanic patients feel seen. Our next subcategory that we talked about was communication strategies. And the first one was to build trust. The professional that I spoke with uses humor and makes eye contact to really get on the patient's level and establish that trust and level of comfort so that the patient can really communicate to the best of their ability with the healthcare provider on what's going on with them. My interviewee felt that EMS, specifically within CareFlight, rarely struggles with communication, and that's because of CareFlight's priority in having translators available for these situations. Next category was health issues and patient understanding. Again, they felt that health issues aren't specific to just Hispanic patients, rather to every race and ethnicity, but non-compliance with medication is a bigger issue, excuse me, and that family often helps with translation a lot of times and to establish trust. And that sometimes when there's no translator or translators in pursuit, demonstrating physically with hands or drawing on a piece of paper is also very helpful until the translator is able to arrive. Then we have family roles and patient respect. Family members usually support decision makings and should be managed with care and calmness, just like the patient, because they are an extension of the patient. And then keeping the family in the loop will also help to maintain trust because most of the times the patient trusts the family. And if you're able to establish that trust with the family, they can help you out in communicating and getting the patient comfortable with you. Cultural beliefs in treatment. Some patients express a lot of concern over being able to afford ambulance services, and while these concerns are always respected, is what my EMT told me, that these concerns are are always respected, but at the end of the day, receiving top quality and giving top quality treatment will always be the number one priority of a healthcare provider. And that even worrying about these financial worries is just not professional, and the main focus is to deliver equal care to all. I really enjoyed interviewing my healthcare professional, especially since I'm not in the medical field and have no plans to go into the medical field. I really wasn't aware of issues that, are present in the Hispanic community and also just in the medical community in general. So it was very interesting to get this perspective and understand the issues that are arising, but also how they're being dealt with and how the translators in establishing trust can help prevent these issues. So, just to end off on this interview, I decided to do an interview reflection on some of the main things that I learned. And that was how family plays a big role in Hispanic patient care. That really shocked me, as well as language tools like translators are essential. They really, really are. And translators don't always include formal translators who are paid by the hospital. Sometimes they're just regular family members. And then humor and body language can help build trust. And I think humor is something that's known across all languages and something that can bring delight to anyone, whether you speak Spanish, Russian, or English. So I thought that was important. As well as cultural sensitivity, and it should be treated like a basic understanding of treatment and not just medical understanding, but financial understanding and understanding that, the concerns patients have with finances. And then finally, cultural competence. Thank you so